global health monitoring networks have focused intense scrutiny on a highly unusual outbreak of the rare hantavirus, tracing a chain of infections that spans multiple continents and oceans. The issue reached a critical point following widespread social media rumors alleging that leaked footage showed hantavirus patients in intensive care units in Cape Town, causing a surge in public concern and internet speculation. Official verification from South African health authorities and global bodies like the World Health Organization, or WHO, provides a far more precise and far less sensationalized reality. The true focal point of the emergency was a Dutch-flagged cruise vessel, the MV Hondius, which was operating a complex route originating in South America and stopping at remote islands in the South Atlantic, including St. Helena and Ascension Island, before tracking toward the coast of West Africa. Public health agencies became involved after a cluster of passengers developed severe acute respiratory infections, marking the first time in recorded medical history that a hantavirus outbreak has been documented on board a marine transit vessel. Viewers and the international public are monitoring these events closely due to the specific pathogen involved, known as the Andes virus strain. While most strains of hantavirus are strictly localized and present zero risk of secondary person-to-person transmission, the Andes variant is unique in its documented ability to spread directly between humans through close contact. This feature has prompted immediate international contact tracing across dozens of countries, as passengers and crew members from 23 different nations have already disembarked or been repatriated from the vessel. Virology and epidemiological data explain that hantaviruses are typically rodent-borne pathogens. In normal land-based settings, humans contract the virus by inhaling aerosols of microscopic particles contaminated with the urine, saliva, or droppings of infected wild rodents. Once inhaled, the virus targets the endothelial cells lining the blood vessels, leading to a rapid accumulation of fluid in the lungs, a condition known as hantavirus pulmonary syndrome. The baseline mortality rate for severe cases can be exceptionally high, often exceeding 30 to 40%, making rapid institutional intervention an absolute necessity. However, medical experts emphasize that despite the internet panic generated by false claims of widespread local transmission or leaked ICU footage from Western Cape facilities, the actual geographic spread of the physical virus remains highly contained. With no ongoing community outbreaks reported anywhere on the African continent, the operational timeline and core developments of this international response involve a highly coordinated network of national ministries, specialized reference laboratories, and maritime authorities. According to official disclosures from the World Health Organization and the South African Department of Health, the index patient was an adult male passenger who had traveled extensively through Argentina, Chile, and Uruguay for more than 3 months before boarding the MV Hondius on April 1st. This individual developed severe respiratory symptoms on April 6th and subsequently died on board the vessel on April 11th without undergoing immediate microbiological testing due to the remote oceanic location. As the cruise ship continued its journey across the South Atlantic, subsequent cases emerged among passengers and crew, including the ship doctor. A turning point occurred when an adult male passenger developed severe symptoms and was medically evacuated from the remote outpost of Ascension Island on April 27th. This patient was flown to South Africa and admitted to an intensive care unit at Mediclinic Sandton in Johannesburg, rather than Cape Town, as early viral social media reports claimed. It was at this stage that South Africa's National Institute for Communicable Diseases, or NICD, conducted diagnostic testing, utilizing polymerase chain reaction and genetic sequencing to officially confirm the presence of the Andes hantavirus strain on May 2nd. Following this confirmation, a series of urgent medical evacuations took place. Samples analyzed by reference laboratories in Senegal confirmed additional infections among passengers who were subsequently evacuated to specialized clinical isolation facilities in Leiden, the Netherlands, and Dusseldorf, Germany. Meanwhile, the Spanish government granted the MV Hondius permission to dock in the Canary Islands for controlled disembarkation under strict containment protocols. South African National Health Department spokesperson Foster Mohale confirmed that intensive contact tracing was launched to locate 97 potentially exposed individuals, successfully tracking down 91 of them. In the Western Cape province, health officials placed 4 specific individuals under active monitoring due to their direct epidemiological links to the vessel. While one of these monitored individuals in the Western Cape did display a low-grade fever and sore throat, extensive laboratory work has confirmed that there is absolutely no widespread community transmission occurring in Cape Town or the broader region. Regional health departments, including the Eastern Cape Department of Health, have formally issued public statements to rubbish parallel fake reports that claimed an active hantavirus outbreak had occurred at Grey Hospital in King Williamstown, clarifying that such posts are entirely fraudulent and generated by automated online systems. Public guidance, preventive measures, and global surveillance protocols for hantavirus remain anchored in established scientific practices, with international experts working deliberately to prevent unnecessary public panic. Dr. Lucille Blumberg, a leading infectious disease specialist and former head of South Africa's National Institute for Communicable Diseases, clarified that while Southern Africa faces significant urban rodent challenges, the local rodent populations do not carry hantaviruses, meaning the regional public faces no structural risk from local wildlife. For regions where hantavirus is endemic, such as parts of North and South America, standard public health guidance dictates sealing entry points to homes, ensuring proper ventilation, and using disinfectants rather than sweeping when cleaning areas with potential rodent droppings to avoid creating infectious aerosols. On board transit vessels and in clinical settings dealing with the Andes strain, authorities are enforcing strict isolation, mandatory mask wearing, and standard airborne precautions during any medical procedures that generate aerosols. Top epidemic experts from the World Health Organization, including Dr. Maria van Kerkhove, have repeatedly emphasized that this situation must not be viewed as a parallel to the COVID-19 pandemic. The Andes hantavirus spreads only through very close, prolonged physical contact, meaning the probability of casual transmission in public spaces remains extremely low, and the general global population is at near zero risk. Significant limits of knowledge still face researchers, as investigations continue alongside authorities in Argentina and Chile to pinpoint the exact environmental exposure site where the index passenger originally contracted the pathogen. Clinical management remains supportive, as there is no specific antiviral cure for hantavirus pulmonary syndrome, though early institutional access to oxygen therapy and mechanical ventilations substantially increases survival rates. Health authorities are maintaining an extended 42-day quarantine and observation window for all verified close contacts to account for the virus's long incubation period, while urging the public to rely exclusively on official statements from verified health departments rather than unverified internet videos. For regular independent journalistic updates on global public health developments and breaking wire service reports, consider subscribing to this channel. The operational timeline, agency actions, and clinical developments of this international response involve a highly coordinated network of national health ministries, maritime tracking authorities, and specialized reference laboratory spanning Africa and Europe. According to official investigation briefs released by the World Health Organization and the South African National Department of Health, the outbreak's timeline began with a single index patient, identified as an adult male passenger who had traveled extensively through endemic rural regions of Argentina, Chile, and Uruguay for more than 3 months before boarding the Dutch-flagged cruise vessel, the MV Hondius, on April 1st. This individual first developed severe respiratory symptoms on April 6th and subsequently died on board the vessel on April 11th while the ship was in transit across remote oceanic corridors, preventing immediate specialized microbiological verification. As the vessel continued its transatlantic itinerary, a cluster of secondary cases emerged among both passengers and crew members, including the ship's onboard medical officer. A critical escalation occurred when an adult male passenger developed acute respiratory distress syndrome and required emergency medical evacuation at the remote British overseas territory of Ascension Island on April 27th. This patient was subsequently airlifted to South Africa and admitted to a specialized intensive care unit at Mediclinic Sandton in Johannesburg, directly contradicting early viral social media assertions that placed the patient in Cape Town. It was at this stage that South Africa's National Institute for Communicable Diseases, or NICD, deployed advanced laboratory diagnostics using real-time polymerase chain reaction and genetic sequencing to officially confirm the presence of the rare Andes hantavirus strain on May 2nd. Following this definitive laboratory finding, a series of international medical repatriations and containment operations were initiated. Diagnostic samples analyzed by regional reference laboratories in Senegal confirmed additional infections among the ship's cohort, leading to the targeted evacuation of patients to high-containment clinical isolation facilities at Leiden University Medical Center in the Netherlands and the University Hospital of Dusseldorf in Germany. Concurrently, the Spanish government granted the MV Hondius emergency permission to dock in the Canary Islands for controlled, medically supervised disembarkation under strict quarantine protocols. South African National Health Department spokesperson Foster Mohale confirmed that a mass epidemiological contact tracing operation was immediately launched to locate 97 potentially exposed individuals who had interacted with the vessel's crew or passengers, successfully tracking and evaluating 91 of them within days. In the Western Cape province, provincial health authorities placed 4 specific individuals under active clinical surveillance due to their documented direct contact with the vessel or its offloaded materials. While one of these monitored individuals in the Western Cape did display a mild low-grade fever and a sore throat, exhaustive laboratory panel testing officially confirmed that the individual was negative for hantavirus, demonstrating that there is zero active community transmission occurring anywhere within the city of Cape Town or the broader municipal region. Furthermore, regional health authorities, including the Eastern Cape Department of Health, have formally issued public declarations to thoroughly debunk parallel social media rumors that claimed an active hantavirus cluster had emerged at Grey Hospital in King Williamstown, clarifying that such digital posts are entirely fraudulent, fabricated by automated online systems, and completely unlinked to any verified medical reality. Global surveillance protocols, diagnostic standards, and public guidance for managing hantavirus exposure remain strictly anchored in established scientific practices, with international experts working deliberately to counter misinformation and prevent unnecessary public panic. Dr. Lucille Blumberg, a leading infectious disease specialist and former head of South Africa's National Institute for Communicable Diseases, clarified that while Southern Africa faces significant urban rodent challenges, the local rodent populations do not carry hantaviruses, meaning the regional public faces no structural risk from local wildlife. In regions of the world where hantaviruses are endemic, such as specific rural valleys in North and South America, practical prevention dictates precise environmental controls to avoid inhaling dangerous aerosols. Public health agencies advise sealing all entry points larger than 1/4 of an inch in homes, ensuring proper ventilation by opening doors and windows for at least 30 minutes before cleaning long vacant structures, and using liquid disinfectants or bleach solutions rather than sweeping or vacuuming, which can inadvertently loft infectious microscopic particles into the air. On board marine vessels, commercial transports, and within clinical settings handling suspected cases of the unique Andes strain, authorities are enforcing stringent airborne and contact isolation precautions, including the mandatory use of N95 respirators, negative pressure rooms, and specialized eye protection during any medical procedures that generate aerosols. Senior epidemiologists from the World Health Organization have repeatedly emphasized that this isolated maritime cluster must not be interpreted as the beginning of a widespread global health crisis, because the Andes hantavirus requires prolonged, highly intimate physical contact or direct exposure to concentrated fluids to spread from person to person. The probability of casual transmission in public spaces, airports, or standard urban environments remains extremely low, leaving the general global population at near-zero risk. Significant limits of knowledge still face international researchers, as field investigation continue alongside agricultural and environmental authorities in Argentina and Chile to pinpoint the exact rural exposure site where the Index cruise passenger originally contracted the pathogen. Clinical management remains strictly supportive, as there is currently no approved specific antiviral cure or vaccine for Hantavirus pulmonary syndrome, though early institutional access to oxygen therapy, careful fluid management, and mechanical ventilations substantially increases patient survival rates. Health authorities are maintaining an extended 42-day quarantine and observation window for all verified close contacts to account for the upper limits of the virus's long incubation period, while urging the public to rely exclusively on official data from verified health departments rather than unverified internet videos. Ethically, this incident highlights the critical need for transparent, verified communication to prevent internet-driven panic from disrupting local economies and healthcare systems, reminding the public that accurate reporting remains the first line of defense against global health anxieties. For regular independent journalistic updates on global public health developments and breaking wire service reports, consider subscribing to this channel.